Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractic Clinic. Let's talk about pain between the shoulder blade when you're just tense between your shoulder blades. Let's talk about that, so stay tuned. Okay, let's talk about pain between your shoulder blades or tension between the shoulder blades. That's more like it. So in order to go over that, I just thought this would be helpful to do. So these are your shoulder blades. They are to be basically laying against your rib cage. This is your rib cage, the back of you. And this is your arm ball inside the socket. So unless your arms at this level are going up, the scapula or shoulder blades don't really necessarily leave the rib cage that much. The problem happens as you extend forward and you're typing. Now the shoulder blades start coming off, going in that direction, which I can't do on this model, but they start coming off, and the muscles that are connecting the vertebrae to the side and under and all the surrounding tissues, the rhomboids, all of those get really stretched. When they get overly stretched constantly like that and they can't do their job as much, it not only impacts the map of your body part with regards to that movement in the brain, but it also stretches the muscles beyond what they need to be, and they're just exhausted at an attempt to bring you from this position to this position. So you get tense in other areas due to other reasons. So a lot of times people lay down on a foam roller, and I'm not a big fan of foam rollers going in this direction. And the reason I'm not is because most people are not conditioned enough to do it properly. So my suggestion is, boom, a racquetball. So some people use much harder balls. Some people use a tennis ball, lacrosse ball, which is way too hard. And what I want you to think about is, and I'm going to show it to you on the wall, but you don't want to run it on the spine, and you don't want to be running it over bones necessarily. You want to be running it where bulk of the muscles are. So that's about this area. And believe it or not, this part of your lower part of your scapula, about this area is here, is where you want to be running this. That's where a lot of tensions come from. So just follow me here. So now that you know what the anatomy looks like, I'm going to start it by putting it there, but only on this side. So I'm going to place it over here, which is there. And I'm just going to lean into the wall with my arms sticking out, just like that. And my body is away from the wall. And I'm going to start at the at the higher end and bring it down. Oh, sorry. I'm going to start from the lower end here and bringing myself up like that and rolling it up and down. I don't know if you can see this or not. Can you see it? See where the ball is? Good. So you want to be able to go like that. And then whatever area that you find that little extra tension on, just move your arms up and down. You don't have to, depending on where you're at, just bring your arm up and down, in, out. See if that makes a difference, if you feel more relief in that. Then when it comes to this area, which is over here or here, what you want to do is you want to place the ball so you know where the bump is, which is right here. And this is where my scapula, the border of the scapula over here, can you see that? Is right there. So I'm going to place my ball right there. I go lean into the wall, start at the lower end, and bring myself up and down just like that. And don't get crazy and do that, or have something that's super hard, just be gentle and patient and go up and down and kind of clean it up a little bit that way. This is what I suggest you do, but the most important thing is now to figure out what you did that caused the problem. That's always what it takes to really make a problem go away. So in these days, I see this posture being the most common problem that we're having. So get up and move around more often. More often means every 45 to 50 minutes, 55 minutes, you get up. If you have a standing up seated desk, that doesn't mean you stand up all day or you sit down all day. You alternate sitting to standing every hour. Set the timer and don't get distracted. You've got a choice, so make it the right one. Thank you for watching. Please subscribe to my YouTube channel and also check out my podcast. If you have Apple or what's the other phone? Google iPhone. It's on the podcast app, and I'm also on Spotify. Thanks for watching. Take care.